What is hypovolemic shock in plastic surgery? Imagine a situation where a patient suddenly feels dizzy, their skin turns cold and clammy, and their pulse races. These signs could point to a serious condition called hypovolemic shock, which is especially important to understand in plastic surgery. Hypovolemic shock happens when the body loses a large amount of blood or fluids very quickly. This loss makes it hard for the heart to pump enough blood to supply vital organs like the brain, heart, and kidneys. Without enough blood flow, these organs can't get the oxygen and nutrients they need, which can lead to organ failure if not treated fast. In plastic surgery, hypovolemic shock most often occurs because of significant blood loss during or after surgery. Procedures that involve large areas of tissue removal or dissection, such as extensive reconstructive surgeries or burn treatments, carry a higher risk. Sometimes, complications like internal bleeding or hematomas can cause sudden blood loss. Fluid loss can also happen from burns, large wounds, or prolonged surgeries where fluids are lost through evaporation or bleeding. Dehydration and shifts in body fluids can also contribute to this dangerous condition. The process starts when enough blood volume is lost. This decreases the amount of blood returning to the heart, which lowers the amount of blood the heart pumps out. As a result, blood pressure drops, and the body's initial response is to speed up the heart rate and constrict blood vessels to keep blood flowing to the brain and heart. However, if the blood loss continues, these compensations fail. The skin becomes cold and pale, and the patient may become confused or agitated. Urine output decreases because the kidneys receive less blood, and in severe cases, the patient may lose consciousness. Diagnosing hypovolemic shock involves checking vital signs like blood pressure, heart rate, and physical signs such as skin temperature and color. Blood tests can help confirm the diagnosis by measuring blood counts, lactate levels, and clotting function. Imaging tests may be used if internal bleeding is suspected. Treating hypovolemic shock in a plastic surgery setting requires quick action. The first step is to restore blood volume with intravenous fluids and blood transfusions if needed. Controlling bleeding is crucial, which might involve surgical measures to stop internal or external bleeding. Supportive care includes ensuring adequate oxygen delivery and monitoring organ function. The goal is to stabilize the patient as rapidly as possible to prevent permanent damage. Safety and ethical considerations are vital. Surgeons must be vigilant during and after procedures, especially those with higher risks of bleeding. Emergency protocols should be in place, and the surgical team must be prepared to act immediately if signs of shock appear. Clear communication with the patient about potential risks, careful surgical techniques to minimize blood loss, and readiness to intervene are essential for patient safety. Understanding hypovolemic shock is key to ensuring patient safety in plastic surgery. Early recognition and prompt treatment can make the difference between a quick recovery and serious complications. Surgeons and their teams must always prioritize emergency preparedness, follow safety protocols, and act swiftly to protect their patients from this life-threatening condition. If you are considering surgery, always discuss risks and safety measures with your healthcare provider to ensure the best possible outcome.